Hold on.
Have I got a story for you?
Okay, go ahead.
So, let's see. This was a little boy, came in. He's probably about 15 months old, I'm not really sure. And the story, brought in by his mom, and the story is that he had fell backwards a couple of days before, 5 or 6 days before. And in that time, there was this bump that came up on his head, and it was kind of tender, kind of painful, and he was kind of, and the kid was, kind of acting like it bothered him. And so on exam, what we found was something about this big, probably about the size of a Kennedy half dollar, probably about quarter's width, poking out, and it was fluctuant. And what we mean by that is if you press on it, it's not hard. You can feel there's sort of a soft fluid inside, and that's an abscess. And so what we have to do for an abscess is to drain it, because antibiotics alone don't work. And what that means is it's called incision and drainage. The old term's lancing. And what you have to do in a normal situation, you are very sterile, and you prep the place, the site, and you give local anesthesia, and then take a scalpel and go in and cut and get all of the fluid out. And a lot of times we'll use like a Q-tip, or sometimes, depending on how big it is, our fingers, to get all the fluid out, and then we sort of milk it. And then we never sew it up, because it'll just come back the next day. We put in backing to let it stay open and heal from the inside out. And so what it does is it sort of heals like this. Because if we let it close, we don't put the backing in, it'll close like that, and you'll just get another abscess in the inside. So we didn't have any real anesthesia, and we didn't have a sterile field, and the child, if you watch the video, you can tell that he was screaming for his mother the whole time. Of course, his mother was holding him. The funny thing is that as I was like holding his head down, I didn't really pay attention to the screams, because I was just concentrating on what I needed to do. And I'm sure it was worse for everybody listening to it than for me actually doing it, because I was just making sure his head wasn't going to move, because I didn't want to cut anything that didn't need to be cut.